Hey future nurses, hope you are all doing fine and welcome back to Scrub and Spoon. Today we'll be having Nclex review on another cardiovascular disorder, the silent killer, hypertension. Okay guys, please watch till the end, subscribe, like, comment, share your best part of this video in the comment section and leave any question you may ask below. Okay, now let's go. A patient with stage 1 hypertension. Which blood pressure reading supports this diagnosis? Now, A, 118/78, B, 124/80, C, 132/84, and D, 145/95. And this is with stage 1 hypertension, guys. And the right answer is C, 132/84. And this is indication of stage 1 hypertension. So guys, for stage 1 hypertension, the ranges is 130 to 139 systolic and diastolic 80 to 89 to be considered stage 1 hypertension. So let's go through the wrong choices. A, 118/78, this is absolutely normal. So long it's less than 120/80, that is normal, okay? And 124/80, this is slightly high, slightly elevated, but it is not, you can't categorize this as hypertension. And D, 145/95, this is categorized as stage 2 hypertension, which is from anything greater than 140/90, that is stage 2 hypertension. Okay, now the next question: why is hypertension often referred to as the silent killer? It's A, it causes immediate chest pain. B, it always represents with headache. C, it causes damage before symptoms appear. And D, it only affects elderly patients. If you have watched my previous video where I explained hypertension, you will know the right answer to this, because like I said, your silent killer is hypertension, and the reason why is because C, it causes damage before symptoms appear. It causes damage to the heart, to the brain, to the kidney before signs or symptoms may appear. Okay, and that's why it's referred to as silent killer. And A, it can cause immediate chest pain. No, it may not. Like I said, you might not even know you have hypertension because the signs and symptoms might not occur, right? And B, it always presents with headache. Other things can present with headache, so you may not know it's hypertension. That's why it's really important to always check the blood pressure. Okay, and it only affects elderly patients. Age really has nothing. You'll be surprised that age really has nothing to do with hypertension, because young ones nowadays will have hypertension, can have hypertension. Okay, now let's go. Which of the following are risk factors for primary hypertension? Select all that apply. High salt intake, kidney disease, obesity, smoking, diabetes, and Cushing syndrome. Select all that apply as true or false. Now, high salt intake, absolutely. Okay, primary hypertension, that's one of the risk factors for primary, absolutely. Now B, kidney disease, no, it's not primary. In secondary causes of hypertension, that is when there are some underlying conditions that will lead to hypertension, right? So kidney disease falls under secondary. Now obesity, absolutely. Smoking, absolutely. E, diabetes, absolutely. Okay, and F, Cushing syndrome, absolutely not. So B and F, these are causes of secondary hypertension. Okay, now let's go. A patient with hypertension presents to the ER. Which symptoms might the nurse expect? Now they're just simply asking you the signs and symptoms of hypertension. A, fatigue. B, nosebleeds. C, chest tightness. And D, all of the above. And the right answer is D, all of the above. You will see, you know, like we said, it's silent killer, but when the signs and symptoms start occurring, you will see all of this, and at that point it could have gotten worse, like almost damaging the organs. Now let's go. Which patient statement shows correct understanding of lifestyle changes to manage hypertension? Lifestyle changes, correct statement. Correct understanding means correct statement, right? I'll start smoking fewer cigarettes. I'll walk for 30 minutes 5 times a week. I'll drink more wine to relax my vessels. And D, I'll avoid all fats in my diet. And guys, the right answer is B. This is a correct statement, that I'll walk 30 minutes 5 times a week. Exercise helps to reduce hypertension, right? So that's the correct statement. And you know, like I said, one of the first things the doctor might recommend for hypertension is lifestyle modifications: reduce stress, increase workout, right? Reduce salt intake. Okay, so now let's go to A. I'll start smoking fewer cigarettes. Reduction is not enough, you need to stop it. So that is wrong statement, right? It needs to be ceased. You need to stop smoking completely. See, I'll drink more wine to relax my vessel. More wine. Alcohol should be limited, right? Should be encouraged to be limited. In hypertension. And D, I'll avoid all fats in my diet. Remember, there are healthy fats, sorry. So you still need healthy fats in your diet. So that is wrong. Let's go. A patient taking hydrochlorothiazide reports muscle cramps and weakness. What is the nurse priority action? A, suggest more water intake. B, check serum potassium level. C, encourage exercise. And D, tell the patient to stop the drug. Guys, and the right answer is B, check serum potassium level. Hypokalemia is a common side effect of thiazide diuretics, right? So you want to always check the serum potassium level, because the signs and symptoms they reported, muscle cramps and weakness, is a sign of hypokalemia. Okay, guys? So that's the right answer. So A, suggest more water intake. Okay, that's good, but it's not your immediate priority, right? As the question asks, because they are experiencing muscle cramps and weakness. Okay, and encourage exercise. This may worsen the condition because they're having muscle cramps and weakness, so you don't want to tell them to go exercise at that moment. Okay, and D, tell the patient to stop the drug. Medication should not be stopped abruptly. It should be tapered off. So you do not tell any of your patients to stop any medication immediately. In any case that have to happen, you have to call the provider, right? And that is if there is an adverse reaction or effect, and the provider will have to decide what to do, if to change the treatment plan or alternatives. Okay, now let's go. The nurse is teaching a patient about lisinopril, that's Hesi inhibitors. Which symptoms should be reported immediately? Dry cough. Guys, I've always told you, when you have to report a signs and symptoms or a condition immediately, that means it is an unexpected findings. That means that should not happen, and that's why you have to report it immediately. It requires immediate intervention. Now, dry cough, dizziness, swelling of the face and lips, and D, fatigue. Guys, I believe if you are following, if you've watched some of my videos, been listening to my videos, you will know the right answer. And the right answer here is swelling of the face and lips. That's sign of angioedema. It's an adverse effect, an allergic reaction to ACE inhibitors. And what is this? Swelling of the tongue, the face, and the lips. And you know, swelling of the tongue can cause restriction of airway, and airway breathing and circulation, your ABC. You do not want to place anything above the airway, okay? Because swelling of the tongue can cause that. So angioedema, and the life-threatening reaction that must be attended to immediately. Okay, guys? And ABD, let's see, dry cough. These are common and unexpected findings with patients taking ACE inhibitors. Okay, dry cough, dizziness, and fatigue. They are common and less severe side effects of ACE inhibitors. Okay, guys? Let's go. Which medication class helps lower blood pressure by reducing heart rate and cardiac output? A, beta blockers. B, diuretics. C, ACE inhibitors. And D, calcium channel blockers. Guys, you already know the answer. Beta blockers. Like I said, double nose. The beta blockers, they lower the heart rate and the blood pressure. So it's saying which class helps you to lower the blood pressure by reducing the heart rate and cardiac output, and that's beta blockers. Okay, diuretics. Okay, furosemide. Those are like diuretics. ACE inhibitors, like I said, lisinopril. Right? They do not lower the heart rate. They only lower the blood pressure. Right? And calcium channel blockers, they cause vasodilation, but they do not directly lower the heart rate. Okay, guys? Now let's go. Which of the following are common used as first line medications to treat hypertension? Select all that apply. A, lisinopril. B, metoprolol. C, amlodipine. D, furosemide. And E, losartan. Guys, and the right answer is ACE. Lisinopril, amlodipine, and losartan. Now, lisinopril, like I said, is ACE inhibitors. Amlodipine is a calcium channel blocker. E is losartan. This is ARBs, right? And they are all recommended first line of treatment for hypertension. Okay. So let's go through the wrong choices. For metoprolol, it is used in hypertension too, but it's often used if your patient also have heart failure, right? And that's why most of this medication, they are both used for heart failure and hypertension. So these three are the first line of treatment, but if your patient also have other conditions like heart failure, then they will give you beta blockers. And D, loop diuretics. They are typical, right? And not direct first line for hypertension. A patient taking antihypertensive stand and becomes dizzy. What should the nurse recommend first? A, take another dose of medication. B, lie down and elevate the legs. C, drink a cup of coffee. And D, skip the next dose. So a patient is taking antihypertensive, right? And when they stand up, they become dizzy. What is this? This is orthostatic hypotension. That is, the blood pressure drop while they were standing up, right? And the right thing to do is to lie them and elevate the legs, because the blood pressure drops, so elevate the legs. So let's go through the wrong choices. A, take another dose of medication. Are you guys kidding me? Right? They are on antihypertensive medication and they're experiencing orthostatic hypotension that is making them feel dizzy, and they should take another dose. You want to kill them, or you want to completely lower the blood pressure? Okay, do not do that. C, drink a cup of coffee. It is unsafe and it is an inappropriate action to do at that moment, right? And D, skip the next dose. This is an unsafe and inappropriate action without a doctor's input. So, and like we said, do not once you are able to lie them flat and elevate the leg, the blood pressure is going to become normal, right? So do not tell them to skip the next dose, right? Like we said, do not tell them to stop medication abruptly or skip the next dose, especially the fact that that order didn't come from the provider. Okay, now let's go. Which food should a patient with hypertension avoid? Grilled salmon, frozen pizza, steamed vegetables, and oatmeal. Guys, the right answer is frozen pizza. You want to know why? Because frozen meals contain high sodium, and patients with hypertension should avoid foods with high sodium salt. Okay, now let's go through the wrong choices. Grilled salmon, this is heart healthy choice. Okay, steamed vegetable, absolutely very nutritious. It's very healthy. And oatmeal is also healthy. It contains fibers, and this is these ones, the grilled salmon, the steamed vegetables, and oatmeal, they are encouraged on DASH diet. Now let's go. A patient asks, can I stop my blood pressure medication now that I feel fine? What is the best nurse response? Yes, since your pressure is normal now. B, only stop it if you have side effects. C, no, stopping suddenly can cause complications. And D, try skipping one dose a week first. I believe you know this, right? The right answer is no, because I've explained this to you. You don't tell them to stop their medications several times, right? No, stopping suddenly can cause complications. That is the right answer, because you don't stop those medications, you taper them off slowly. That's what it means. So let's say you want to stop a medication. If you are taking 40 mg, the doctor would reduce it to 20, to 10, to 5, so that you do not have rebound hypertension, or the signs and symptoms do not get worse. That's why. So the meds must be either taper off or continue for a lifelong as a lifelong therapy for the blood, to control the blood pressure. So all the wrong choices, the A, the B, and D, they are misleading, and it can cause rebound hypertension. And rebound hypertension it will be worse. So that's why. Now let's go. Uncontrolled hypertension increase the risk of which of the following? Uncontrolled hypertension increase the risk of which of the following? Stroke, select all that apply. Stroke, myocardial infarction, kidney damage, cataract, and heart failure. Guys, this is select all that apply. Stroke, absolutely yes. Uncontrolled hypertension, like I said, the silent killer, yes. Myocardial infarction, absolutely. Kidney damage, correct. Cataract, that has to do with the eyes, no, has nothing to do with the hypertension, no. And heart failure, absolutely. That is absolutely right, because hypertension damages the vessels and organs, and that will lead to all of these except the cataract, the D, which is not this indirect complication of hypertension. Now let's go. What instruction should the nurse give for accurate home blood pressure monitoring? Take it after a workout. Cross your legs to relax. C, sit quietly for 5 minutes before checking. And D, measure only when you feel dizzy. So they're just trying to ask you the correct way or the accurate way of measuring or taking your blood pressure at home for a patient, right? Take it after a workout. You don't want to take a blood pressure after workout, because after workouts you've exercised, the heart rate is high, the blood pressure is high. That's not the right time to take your blood pressure, right? Cross your legs to relax. Now, crossing your legs to relax can affect the result, because that can affect the flow of blood, right? So that can give you inaccurate results or readings. Now, sit quiet. Okay, so we said the right answer is sit quietly for 5 minutes before checking, which is the right answer, because by the time you've seated quietly for 5 minutes, everything is balanced, the fluids, the electrolyte, the blood pressure is stable, then this is the right time to take it. Okay. And measure only when you feel dizzy. Why do you want to measure your blood pressure only when you feel dizzy? Blood pressure should be encouraged to monitor or to check almost regularly, not because you feel dizzy. Well, if you feel dizzy, you can also check to see like, okay, what's going on? Why am I feeling dizzy? But that's not the only time you should check. Okay. So that's right answer. Patient prescribed metoprolol has a heart rate of 52 BPM. What is the priority action? A. Administer the drug. B. Give half the dose. C. Hold the drug and notify the provider. And D. Recheck blood pressure in 15 minutes. Guys, I have explained this before. If you have seen some of my videos, that with metoprolol, they lower the heart rate. This is beta blocker and the blood pressure. You want to check the heart rate for at least 1 full minute before administering. And if the blood pressure if the heart rate is lower than 60, you do not give. You do not give. You have to hold that medication, right? Hold that medication and notify the provider. Okay. So let's go through the wrong choices. Administer the medication. You do their heart rate. The heart rate is already 52. If you should give that, do not do that, because if the heart rate drop, you know what that's what can happen. That's not gonna be good. Heart rate is already 52, so if you should give them more, if you should give them the metoprolol, that will lower the heart rate even more, and that's not what we want. B, give half the dose. No, this is not right. Do not give half the dose. The order of this medication is if the heart rate is lower than 60, hold that medication to not give. So why do you want to give them half the dose? Okay, you're thinking giving them half the dose might not worsen that much or reduce the side effects or complications they can get. No, for beta blockers like metoprolol, do not give if the heart rate is lower than 60. And D, recheck blood pressure in 15 minutes. We are talking about the heart rate. Yes, beta blocker lower the heart rate and the blood pressure, but you are checking your heart rate and they're giving you that the heart rate is 52 BPM. So the best thing to do is hold that medication. And for blood pressure, if the blood pressure is lower than 100, you do not give. Okay. And that makes the end of this video. Please like, subscribe, share, and leave your comments in the comment section if there is any part of this Nclex review that you enjoy the most. Thank you.